Hello everyone, my name is Dr. Shitish, and in this video we are going to learn step by step how to do vectorial analysis of myocardial infarction in ECG. So let's get started. The minimum basics what we need to know about the ECG is the P wave is because of the atrial depolarization, the QRS complex is because of the ventricular depolarization, and the T wave is because of the ventricular repolarization. Now, what is important for analyzing the ECG of myocardial infarction is two things. The ST segment, as you can see here, ST segment starts from the end of S wave and ends at the starting of T wave. This is the ST segment. And the second thing is TP interval. This TP interval starts from the end of the T wave and ends at the starting of the P wave. This is our TP interval. One more simple basics what we need to keep in our mind is the axis of various leads. As you can see in the diagram, this is the axis of lead 1, standard bipolar limb lead. So the negative end of this lead 1 is on the right side and the positive end of the lead 1 is on the left side, and this axis is lying at the 0 degrees. And as you can see, each axis have a negative end and a positive end, and they are lying at a certain degrees. So lead 1 has axis of 0 degree. Coming to the lead 2 bipolar limb lead, it has an axis of 60 degrees. Lead 3, it has an axis of 120 degrees. And then augmented limb leads, AVF has a axis of 90 degrees, AVR has an axis of 210 degrees, and AVL has an axis of minus 30 degrees. So these axes you have to keep in mind while doing the vectorial analysis of myocardial infarction. Step 1. Look out for the J point. All this disturbance created in this ECG of the myocardial infarction is due to this injured area. As you can see, this injured area stays depolarized continuously throughout the cardiac cycle. But this depolarization of the injured area can be masked when the ventricle is completely depolarized. At this point, at the end of the QRS complex, the ventricle is completely depolarized and masking this injured area. And at this point, the ECG returns to the baseline, and that is why it is very important to determine the J point. Step 2. Draw an isoelectric line or the zero reference line from the J point. As you can see here, the QRS complex is ending at this point, and as we have seen in the previous step, this point where the QRS complex ends, this point is the J point. So considering this as the J point, we are going to draw the isoelectric line from this point. As we can see here, the QRS complex is ending at this point, and from here we can draw an isoelectric line from this point, which will help us in further analysis of myocardial infarction. Step 3 is finding the vector of injury potential. For this, we have to see just in the TP interval. As we have seen before, the TP interval just before the P wave. This is in the lead 1 and in the lead 3. Just before the P wave we are marking. And then from the isoelectric line or the zero reference line, we have to draw a vector towards the starting of the P wave. We have drawn in the lead 1 and in the lead 3. Here we can see from the zero reference line, the vector is drawn towards the starting of the P wave. This gives us the vector of the injury potential in myocardial infarction. As we can see here in the lead 1, this vector is pointing upwards and the ECG is above the zero reference line. That is why it is a positive vector. Whereas in lead 3, as we can see that it is pointing downwards and the ECG is below the zero reference line. That is why it is a negative vector. One thing that can help us in the further step is to count the boxes in between these 2 points. As we can see here, almost 5 small boxes are there, and in lead 3, to count the boxes, almost 5 small boxes are there. Okay, so this will help us in the next step of analyzing vectors for myocardial infarction. Step 4 is plotting of these vectors of injury potential and finding out the resultant vector. For this, first of all, we are going to draw the axis of these leads in which we have seen the injury potential. The axis of lead 1 is 0 degrees with negative end towards the right and positive end towards the left. And the axis of the lead 3 in which we have seen the injury potential, negative end here and the positive end here. Now, as we have seen a positive vector in the lead 1, we are going to draw a positive vector of a similar amplitude. What you can do is, if you have found a 5 small boxes, you can multiply it by a constant number, let us say 1 centimeter, and the 5 small boxes can be multiplied by this 1 centimeter, and you can draw a 5 centimeter of vector. And in the same way, in the lead 3, as we have seen a negative vector, we can draw a negative vector on the negative side of the axis. This is how we are drawing the vectors of the injury potential in each lead. And now how to find out the resultant vector. First of all, we have to draw a perpendicular line from the tip of these vectors. Drawing a perpendicular line from the tip of lead 1 and drawing a perpendicular line from the tip of lead 3, the injury potential leads. And then from this 0 reference line, I have drawn a resultant vector where the perpendicular lines are intersecting. So this red line is our resultant vector, which is telling us about the injury potential. How to interpret this injury potential, we'll see in the next step. Step 5 is interpretation of this injury potential, the vector of injury potential. As you can see the vector of injury potential here, let us draw the vector again here. The importance is the amplitude and the direction. So as we can see the direction, we have the positive end of the vector and the negative end of the vector. One thing we have to remember to interpret this vector is the negative end of this vector. That is, this end of the vector will point towards the injured area of the heart. So while interpreting the vector, what we have found out, we have to see where the negative end of this vector is lying, and this vector, the negative end of this vector, is pointing towards the injured area of the heart. Step 6 is analysis of injury potential in the chest leads, that is lead V1 to V6. As you can see here, the QRS complex is ending here. So from the J point, we have to draw an isoelectric line. And from this isoelectric line, we have to draw a vector just at the end of the TP interval or just at the beginning of the P wave. As the ECG is lying below the 0 electric line, the vector is negative. So there is a negative vector. And then to analyze this vector, let us see here that the chest leads are placed in front of the chest anteriorly. So the positive direction of this axis will be anteriorly. If we draw the axis of this chest leads, it will be in this direction, positive anteriorly and negative posteriorly. And if we draw this resultant vector, as it is negative, we have to draw it in the negative direction. So if we get this resultant vector and find out the negative end, this negative end is pointing towards the anterior wall of the chest. So by the analysis of this chest leads, we can know whether the myocardial infarction is lying in anterior or the posterior wall of the chest. As in this case, the myocardial infarction is lying on the anterior wall of the ventricle. So let us analyze this ECG for myocardial infarction. First of all, I'll find out the J point and draw an isoelectric line in each leads. As you can see here in the lead 1, there are no significant changes of myocardial infarction present. Whereas in case of lead 2 and lead 3, changes are seen clearly. So we are going to plot the injury vectors in lead 2 and lead 3. As you can see, both are negative vectors. Let us find out the resultant vector. The axis of lead 2 is 60 degrees and the axis of lead 3 is 120 degrees. Positive end, negative end, positive end and negative end. As we can see, both the vectors are negative. We have to plot in lead 2 a negative vector, and in lead 3 also the vector is negative, a negative vector, and then draw a perpendicular line from each leads, tip of the each vector, and then find out the resultant vector. As we can see, this is our resultant vector and the negative end of this vector is facing downwards. So we can see this myocardial infarction is present in the apex of the ventricle. And let us now analyze the chest lead. From this J point of QRS complex, I have drawn a isoelectric line, and this is the injury vector, injury potential vector in the chest lead. As we have interpreted it before, V2 anteriorly, the vector of this V2 lead will be in this direction, axis will be in this direction, and let us say the vector is positive, so the resultant vector will be also in the same direction. As you can see, the resultant vector is in this direction and the negative end of this vector is facing towards the posterior end. So we can say that the myocardial infarction is lying at the posterior wall of the ventricle. So from this analysis we understood two things, that the myocardial infarction is lying at the apex of the ventricle and it is lying on the posterior wall of the ventricle. This is how we have to analyze the ECG by the help of vectors. Thank you very much for watching this video. Hope you will like it.